So, welcome to our presentation on the role of nurses in antimicrobial stewardship. So, we've discussed already the grave concerns around antimicrobial resistance and some of the work that nurses are already doing within hospitals and what they can do within hospitals. And now we're looking at nurses to be more involved in leadership capacity and on committees and actually part of the antimicrobial stewardship teams in hospitals. So the article starts off with an introduction discussing again that antimicrobial resistance is a huge global threat and the really important role of antimicrobial stewardship programs within healthcare systems. Nurses are critical but underutilized resource in AMS, and the objective is to understand the barriers and the facilitators and look at the rules for nurses in AMS. So antimicrobial resistance, as we know, is a global challenge. There's significant amount of statistics on drug-resistant infections. It has an impact on clinical outcomes, so patient care outcomes, healthcare costs are rising, and human lives. People are dying from really insignificant infections because of resistance. WHO projects that healthcare workforce shortages by 2035, highlighting the important role of nurses in taking on some of the more important roles around antimicrobial stewardship. So, nurses in AMS, the current landscape. So, we know nurses are the largest healthcare workforce globally, but they've been historically absent in AMS leadership programs. And some of the roles that nurses have, though, been involved in at the bedside and kind of out of that leadership role are administering antimicrobials. So let's think about nurse practitioners. Nurses have been involved in ensuring accurate biological sample collection. So they've been in the ones that have really been at the forefront of making sure that sputum samples are taken or urine samples are taken before antibiotics are started. And then a lot of great work around patient and family education that nurses have done with respect to antimicrobial resistance. So, what are the barriers to nursing engagement in AMS? Well, there's four big barriers. The first one is foundational barriers, where AMS is not perceived as a nursing role. Ownership and branding. There's misalignment between nursing activities and AMS recognition. So nurses are already doing a lot of the AMS roles already, but they're not being recognized as doing it, and so there's misalignment. Educational gaps. There's limited AMS content in nursing curricula, and leadership challenges, lack of formal leadership opportunities in AMS for nurses. And I think this is a significantly and really vital role for nurses to be involved in. So, what are some of the facilitators that we can think about for nursing engagement? So, let's start here. So, first of all, expanding education and training on AMS, incorporating AMS into nursing standards and competencies, encouraging interdisciplinary collaboration, and developing nurse-specific AMS resources. So maybe e-learning or those virtual games that students can learn in their nursing school. So we do have some great case studies and best practices that nurses have already been involved in. So these are some successful nursing-led AMS initiatives already that really probably nurses aren't getting the recognition for. One of the big ones we see is the UTIs in care homes. And I've seen this firsthand with my mother, who was in a long-term care facility. And nurses were the first ones to, if an elderly patient became confused, one of the first things that you think about is an infection of some sort. And the nurses were always the ones to always do a urinalysis before calling a physician. And that was a way to make sure that is this truly a UTI that needs antibiotics? And so they actually decreased antibiotic use by being proactive and doing a urinalysis first before starting on antibiotics. Another thing I saw as well was these structured hydration rounds. And so in the elderly were concerned about dehydration. And so nurses did structured hydration rounds. And although it did target dehydration, what it also did was decrease UTIs and subsequent hospital admissions. And then other things is that we've seen a lot of nurses be involved in research and quality initiatives in hospitals. So, nurse driven reviews of antimicrobial use in critical care units is one. So, the way forward is addressing these barriers. So, enhancing AMS education in nursing schools, promoting nurse leadership in AMS committees. So, I would encourage you to be on these committees in your healthcare institutions when you do graduate. Networking and mentorship for nursing professionals in AMS, and aligning AMS with our core nursing values around person centered care. So the conclusions are that nurses are vital to AMS success but remain underutilized. We need to address the barriers that can unlock nurses' potential in combating antimicrobial resistance, and we're already seeing some of these. And our call to action is educators, policymakers, and healthcare leaders must support nursing involvement in AMS. Thanks for listening.